Oh, how to, hold on. Okay. I will start sharp at 8. Assalamualaikum and a very good afternoon, Indonesian time, and a very good morning, Netherlands time. First of all, I would like to welcome Professor Evert Verhagen. Thank you very much. It's such a pleasure for us to have you here today with us. To Dr. Nani Cahyani as the head of sports medicine divisions of the medical faculty of Universitas Indonesia, honorable guests and all fellow audiences. So before I start with Professor Evert, I will share some of his curriculum vitae. So Evert is a professor at the Department of Public and Occupational Health and Amsterdam Movement Sciences. He is the co-director of the Amsterdam Institute of Sport Sciences. He is also a co-chair of Amsterdam Collaboration on Health and Safety in Sports, which is one of the IOC Research Center of Excellence. Evert is also an editor-in-chief of the BMJ Open Sports and Exercise Medicine. Actually, Evert has a very long list of CV, which I'm not going to read them because it will take me more than 5 minutes after this. But I myself always describe him as my cool professor. He is a very humble person, I would say, and he has a very interesting personality. So I share some of, hold on, I don't know why I can't. Okay, so since we're going to talk about physical activity, exercise, and then sports, so I would say Evert will not only talk about this, but he himself is a good example of what he's going to talk about today. He is an athlete himself. He is a endurance runner of ultramarathon, trail runner, and as you can see, his quote of what running according to him. So the left side is his shadow when he do the trail running, and the right side is, I think, when you did the ultramarathon. He is also a master diver. So every time he did the diving around the world, he will share beautiful pictures under the sea. As you can see here, how beautiful he got the pictures when he went to Bali. And then he is also a very talented photographer who take the opportunity of his time traveling around the world with beautiful pictures. So sorry, I boasting myself being how lucky I am for being his social media friend. And as I said, that he is a very interesting person. So this picture caught me. What he did when he traveled. Evert, just to remind you, don't be surprised if after this you have followers from Indonesia wanting to know more about you. Okay, before I start with the lecture, maybe I would like to inform the audiences, if you have any question after this, please don't hesitate to pop out your questions in the chat box, and please use the format which is given by the organizer. So without further ado, to Evert, the time is yours.
Thank you, Laily. Oh, you make me sound really interesting. Doubt I am.
Hold
You can
on.
see
I
my
need to stop
screen if
sharing.
I do.
Hold on.
Yes.
Yeah.
And now you see mine.
Yes.
Ah, perfect. So thank you so much for that introduction. It was a bit unexpected on my early morning, but fun to see that you all see that I have a fun side too, instead of being that picky professor in the office all day. Yes, we do research on sports, and we want to make sports healthy. So we do a lot of work on the healthy side of sports. So make sure no one drops out being injured or with any illnesses. But of course, it all starts with getting people active. And why do we need to get people active? That's also a large part of the research we do in Amsterdam. And we try to bring exercise and also sports into the doctor's office, because there's a strong link with health and exercise. And sometimes that link is much stronger than some of the medication we can prescribe to patients, and much more durable and much more effective as well. So maybe a little bit of a history lesson. You probably know this image, how we evolved from being physically active to being physically inactive behind our computer screens. Maybe today is a bad example, us looking at the Zoom screen. But let's see if we can change that again. Let's see if we can get off that bench and get active again. And maybe that history lesson is a little bit important, because physical activity and exercise has had a role within history. And from the early days, this is probably an example you've heard before. We had to be active to survive. Now, you had to run, you had to excel, you had to have endurance and strength and agility to be able to make sure, just simply to survive. There were no supermarkets. You had to find your own food. You had to hunt. So this was a long time ago, and society progressed. And then in the ancient Greek and the ancient Latin time, physical activity and exercise was a way to prepare yourself for war. You had to be strong and fit and agile to protect your vast kingdom. And yes, then the Olympics originated, but that was just a showcase to show how good and strong and fast and skillful you were. And in the Middle Ages, that all dwindled and declined. Yes, some people were active, and those were the knights, the defenders of the king. But for the rest, physical activity was not a virtue anymore. Physical inactivity was a virtue, because the bodily movement changed in light of the Catholic Church back then. But that changed again in the Renaissance time, when we started to understand how the body worked. And in fact, the first books about physical education and healthy exercise were written in the Renaissance time. And that's a long time ago. So we think physical activity and then exercise and the education around it is relatively new, but it's not. It originated already in the Renaissance. And this was a complete shift as to the years before. And then late 1800s, early 1900s, the gymnastics movements came in, and physical activity was something for the community. Men, women, everybody had to be active. It was a showcase, again, of how good you were, how skillful and how educated you were. That changed in the 50s and the 60s. It was not so much about being skillful. It was about showing your muscles. And maybe in the 80s that changed again. Maybe we all know this one still, Jane Fonda doing her exercises. And we're going a little bit back to this, potentially. So it was about fitness. But mostly, this is who we are right now with physical activity. We are the couch potatoes, the couch potato generation. There's less activity. Activities are still going down, even though the youngsters, I do see it in the fitness, are a little bit more active, but not for the reasons I've showcased before. Now, if you put this into perspective, there is an evolution in the need to exercise, where completely in the beginning of my history lesson, there was a need to exercise to survive, because you had to gather your food, you had to hunt. But right now, there's also a need to exercise to survive, because we've become couch potatoes with all the chronic illnesses attached to it. Well, life expectancy going down. So exercise is nowadays also a mode of survival, because without exercise, without sports, there's all these diseases, non-communicable diseases. And the American College of Sports Medicine recognized that. So they say exercise is medicine already for a long time. And this is becoming mainstream now. There's a lot of research being done showing that exercise is a good medicine, a preventive medicine, so to make sure you stay healthy, but also nowadays as a medicine within the clinic. People with diabetes, people with hypercholesterolemia, heart disease, exercise can help. So maybe bringing that a little bit back. Now it's about exercise as a medicine. So what do we want to achieve with medicine? We want to optimize an individual's health. That's our main goal. And we have different tools in our toolbox. So the first thing is primary prevention. Strategies to make sure that people do not get sick. Make sure they stay healthy. If that fails, we have proper care in our toolbox. Make sure that we provide them with the proper clinical care needed. And after that, there's secondary prevention. So once they return to the original state, what can we do to keep them there? So these are, in gross view, the tools we have. There's also, of course, tertiary prevention, but that goes further. And I want to focus a little bit on these because they blend in mostly. We want to get people off the couch. We want to get them not being the supporters, but we want to have them to be part of exercise and part of sports. These are the WHO guidelines, the new ones. They were published in 2020. They tell you how active you need to be, how many minutes of moderate intensity activity you have to accumulate per day, per week, to have at least a basic level of health. That's basically what this says. You can look them up online. It's all available. Let's not go into much detail now. It's not much time. But basically, they say three things: physical activity, exercise, and sports is kind of hidden in there. But what are these things? Physical activity is any bodily movement produced by your muscles, and it results in energy expenditure. So you can go for a walk outside. That's physical activity. That's fine. It's not exercise yet. Exercise is one level up. It's a planned, a structured, and repetitive bodily movement in which you aim to improve or maintain your physical fitness. So that's one more level up in terms of intensity as opposed to physical activity. The guidelines say you need to be active, but you also need to be intensely active. So exercise is in there. Now, what is sports? Sports is a form of exercise, but added to that, we add the component of a social structure. And you need to adhere to rules and regulations. That's what sports is. So it's exercise by certain rules and certain regulations. And there's a goal of winning in it. So it adds this element to it. And I think we can harness that. Because this is what the guidelines say: at least 75 to 150 minutes of vigorous intensity aerobic physical activity. That's exercise. And some of these exercises need to be muscle strengthening for at least 2 days a week. Sports can fit in there. And then why is sports so important? Because you can just go outside and go for a run. You can go to the gym. You can go to the fitness. You get this as well. But not everybody likes that. And there's an additional benefit of sports. Let's go there. There's been studies done that show that football can be a really, really good medicine. And you see the people playing here. These people are cancer survivors. And they had prostate cancer, and they were cared, and they were cured, but still they need to benefit from, or they need to rehabilitate to get their fitness and health back. And what they did in hospitals, they created these football clubs for these people. They can compete against each other, and it's a great success. So they have the physical activity, they have the exercise benefits, but they also have a social benefit because they compete with fellow patients who had the same, what they had, and they're all in the same boat, and they love it. And there's a lot of research being done on this out of the University of Denmark. You can look him up, Peter Kustrup. And every project they do around this exercise and sports related realm leads to physical benefits, leads to social benefits, and leads to a faster recovery from their disease. So football as medicine has proven to be effective. And if football can be effective, any other popular sport in your certain area can be effective. In Amsterdam, we did something similar. This is not so much with patients. This is more around primary prevention. Football is an immensely popular sport in the Netherlands. And there's a lot of fans going to these clubs. And these fans usually are not the most healthy, let's be honest. So what we thought of, a big European project, why don't we make these fans part of the club, but the club gives them an exercise program. So you can be a player in your own club that you support, and the club provides you with the exercise program. And here you see some of those happy participants of that study. You see they're not maybe the fittest, and they could use a little bit of physical activity. So that was published as well in 2019. And during the intervention, it was highly effective. You see on the left, the number of steps per day increases in the middle. And on the right, you see the number of minutes per day seated that declines in the middle. Only if you see 12 months on the x-axis, then 12 months is 12 months after the program stopped. And here's the big challenge we have. These programs are really effective. We increase physical activity, we decrease sedentary time. But once we stop these programs actively from a research perspective, people tend to go back to normal and drop out. So we do have an implementation issue here. Highly effective, it just doesn't seem to stick. This is all about physical health. There's other ways we can use sports for health and sports as a medicine. And I think the FIFA for Health program was a really good one. And it's sad to see that discontinued. But they brought 11 rules, 11 players on the pitch, around football-specific skills, in this case to Africa. And each of those skills had a certain health message to it. Highly, highly effective in bringing normal health messages that make sense to us, to local communities to which that information is not always available. But football, they understand because sports unite. Highly effective as well. So now we talked about the 11 for health that was focused at local communities, mostly at youth. We also do a lot of research in our own communities in youth and sports and health. And we have an issue with youth in sports and health. There's a lot of injuries in youth participants. And here you see a cohort. We followed them for 1 year. These are 10 to 12-year-old children. And you see the number of injuries per 1,000 hours of exercise. And on the left, you see all the exercises clubbed together. So it's around 0.5 injuries per 1,000 hours of participation. Then next to that, you see doing physical education classes. How much different? Leisure time physical activities when the kids play outside, and sports. So the risk of injury during sports is highest. So sports does have an inherent risk in there. So it's good, but there's also a downside to it. So we thought, let's try to change that. Let's give these children a warm-up program, an exercise program to help them to prevent these injuries, called the iPlay study. And here you can see the outcomes, and it was highly effective, 30% less injuries in children by simply adding some warm-up and skillful exercises in the physical education classes. It was overall effective, significantly effective, but doing sports and leisure time physical activities, we also do see a decrease. That's not significant. Now, there was something strange with these data, and we dug a little bit deeper. And there was something that was quite troublesome in our view. Here you see on the x-axis the levels of physical activity of these children. And we nicely cut them up in quartiles, which means we took a whole sample, and the least 25% active kids are on the Q1. So these are the least active kids. The highest 25% active kids are in Q4. So those are the highest active kids. And here you see the injury risks. You see the pattern here. The least active kids have the highest risk of injury. Now, we normally do not see that because we always put injuries per 1,000 hours or number of injuries when we do our policies. So there's 100 injuries here and there's 100 injuries there. If you do not participate in activity, you can't get injured. But the moment these children do participate in activity, per hour they participate, the risk is much, much higher. So we do have an issue here. We try to get all these kids active. We try to give them through physical education classes the benefit to enjoy exercise. We want them to be part of a sports club, but then they drop out because they are the ones with the highest injury risk. Now you could say maybe that is because these children have a high risk by themselves, or you could say because it's due to the physical inactivity. They don't have the skills to be healthy active. So we set out to do that a little bit. And we checked motor fitness in these children. And we had a similar cohort in 1980, so 25 years before we did this study. And we did the exact same test in these children. And 100% is the score of 1980. So if you go higher, like standing high jump, for instance, that means that the children with the same age and the same level are better in 2006. So they jumped 20% higher. Fine, perfect. But all the other outcomes were worse. So in general, motor fitness of children have declined over the last 25 years here in the Netherlands. So let's focus then on increasing motor fitness of children, because if motor fitness is the link to higher risk of injury, then if we improve motor fitness, maybe we can do something about it. Highly effective again. So this is just a program increasing the motor fitness levels of these children, and even more effect than in the previous study. So there clearly is a link between motor fitness and injury risk. Then how to implement that? It's nice to know, but then what? So we looked at the playgrounds in schools, and this was a project done by Mirka Jansen, and she went to these schools and she changed the curriculum. So she got kids into the gym, teaching them sports. So we taught them games that revolve around sports skills, little football games, see, like with playing with the cone, rope skipping, baseball game. And all we did was provide the same materials on the playground. So we taught them a little game, a sports skill in the class. And then when they went outside to have their recess time during school, all we had to do was put a football down. The kids pick it up and they start to play these games without any further intervention. And the good thing is, during that little break they have 2 times a day, the number of step counts increases tremendously. So highly effective. And then imagine that, we already said so in the introduction briefly, the Netherlands is usually cold, windy, and rainy. So kids don't like to be outside and be active. But this was highly effective because kids want to play. They want to compete against each other. They want to participate in sports. It's the nature of children. And here's the outcomes on motor fitness after this intervention. Motor fitness increased. Wonderful. Now, schools told us, yes, but the kids come to school because we have to teach them mathematics, languages, geography. We're not here to reduce injury risk or increase health. That's not our job. Fair enough. So we told them, okay, but physical activity is also a good mental exercise. So what we did, this is a selective attention test. That's how you call this. And what children need to do, they get this big sheet with all dogs and cats and combinations, and they need to find the pairs as quickly as possible. And that's time. And that's a measure of selective attention. How good do you pay attention? So it's not a measure of how smart you are. It's really how good can you focus. And if we kids give them this test, and this is the average time they take. This is not in seconds, this is in minutes. No break. So we do the test. They keep doing their schoolwork for 15 minutes and we do the test again. There's no effect. The test is equally bad. Then we do a passive break. So we give children the test, then they don't do anything for 15 minutes. They just sit there. They improve a little bit, but not significantly. Then we have a break with moderate vigorous activity. That's the activity we endorse when we give them the football on the playground, when we make sure they are a little bit active. So pre and post, significant difference. They pay better attention after a 15-minute break of moderate vigorous physical activity. And then we also did a vigorous activity trial in which we really wore them down. So they all had a standardized exercise scheme. They had heart rate monitors and they were really, really tired. And then you see that selective attention also doesn't really improve. So that activity we endorse on the playground is highly active or effective. More activity, less injuries, better paying attention in class, just by being able to participate in sports on a daily basis. So I'm just connecting dots here. So this is in children, but I think the same applies to adults. So physical inactivity leads to lower motor control, leads to a lower proficiency to be part of sports, by which you don't like it anymore. You also have a higher injury risk, and you drop out. You don't like sports if you're not good at it, if it hurts, and if you lose all the time and people laugh at you. So we can turn that around through physical activity, through sports. Increases motor control, because you need to have motor control to be able to participate. You get better in it. Your injury risk lowers, and you have more fun in it because you can become better. So I do think we have a really, really powerful tool in sports to get children and also adults out of the couch. So this is kind of a research line we did in schools, like, you know, promoting in activity, increase motor control, performance, decrease injury risk. Highly effective. Now, how do we make sure children keep doing that? And that's this foundation. This is the one and only winner of a Grand Slam tennis tournament we have in the Netherlands. And he came out of a socially deprived neighborhood. And he said, I never got a chance to play sports. So I want to bring sports to the neighborhoods. So he created all these playgrounds where kids can go for free and they can participate in sports. And then here's one of those. This is a really nice one, by the way. Normally they're not as nice as what you see on the picture here. But kids are there, they're happy, they're having fun, and they're having fun with friends. And then you see on those playgrounds that definitely the kids are more active there. So there's more kids present than on the regular playgrounds during the time that they are open. And there's more boys and there's more girls present. So just give children something to do, give them fun for free, and they'll do it. That's kind of the baseline here. And this is highly effective. There's more and more of these popping up now in the net. Well, let's get back to our main goal, sports as medicine, right? We're doing quite good, I think, in the Netherlands. This is 10 years ago. We had 11 million active participants in 2009, and we have 16 million in 2013. This is kind of old data, but it's quite difficult to get these data out of the ground. 5 million more in 4 years. That's a lot. And you know where? Running and fitness. And running and fitness are sports or really intense exercises that people usually pick up to be physically active. So that's good. And there's a lot of benefits to it. People start doing this because they want to reduce weight. They want to have a healthy lifestyle in general. And the benefit of running and fitness is that it's easy. Oh, you go to, I don't know if you have that in Indonesia, but Laily knows the Basic Fit. It's really cheap, 24/7, it's open, and it's really, you don't need much. You also don't need to be rich to be part of such a fitness club. For running, you buy a pair of shoes and you can go, basically. And really quickly you benefit from that. You don't have to have a lot of skills to be able to run or to be able to participate in fitness. Yes, you can get better in it, but you need to do a little bit to have it. And there's social elements to it because you do it with other people usually. And it's highly, highly beneficial for your health. After 6 months, your body mass reduces, your body fat reduces, your resting heart rate reduces, your fitness levels as measured by VO2 max increases, or your cholesterol levels are better. In general, it works. Awesome, amazing. Sports is healthy. We know that. The people usually don't know it. Sports is also being used as a medicine already. This is running therapy. And this is a specialized program for people with psychological or psychiatric issues. Running therapy has been proven to improve mood disorders, decrease anxiety, improve when you have stress or burnout symptoms. All these things are beneficial for all of the conditions. So why don't we do sports? I must say. There's some issues though, and I already said so. So this is a picture of a COVID vaccine. Makes sense. You know, you need to have a vaccine and then we solve the problem. If we say that exercise is a medicine or sports is a medicine, we need to acknowledge the side effects. And I think this is where we fail mostly, because children want to pick up activity when you give them a ball. Adults seem to be participating in running and fitness because they have a general tendency towards health, but we never tell them about the adverse effects. So if we say that exercise is medicine, I think we also need to say that there is a risk of injury and we need to do something about it. If you have a new pill, 1 in a million people can get a certain outcome, you need to tell them that. But if we do exercise as a medicine and there's a risk of 1 out of 100 that you might sustain an injury, no, let's not talk about that because that's negative. And I think we need to change that because injuries do exist. And the problem is they exist in a certain group of people. So this is the health benefits versus health risks. It's a theoretical model. On the x-axis, you have the type and the amount of activity. And on the y-axis, the benefits of health and fitness. And here you have the various levels of physical activity you could do. So you could do active living. That's the activity. Then you have activity for health, moderate activities, or exercise for fitness. And then you have training for sport. So there's a gradation here, the least active on the left, the most active and intense on the right. And then hypothetically, this is the relationship. So you need to do a little bit of activity to have a lot of health gain, but you need to do a lot of activity to increase your risks. That's the hypothesis here. We've shown it's not really true. Look at this. This is running and fitness. I already showed you that there's an increase in the number of participants in running and fitness, mostly in the Netherlands. And you see that the line increases. So despite us promoting physical activity and health, the risk seems to increase of injuries, of dropouts too. One third of people drop out with injury already. And if we break these apart, the blue lines are the novice participants, the participants who start with these exercises. And the red ones are the ones who have been doing it for quite a while already. Do you see the difference? In running, novice athletes have double the risk of injury. That's a lot. And again, 1/3 of these participants drop out within 6 months because of an injury. So yes, healthy, but there's side effects and we can prevent those. So we need to focus on that. So to round this up, it was really quickly in half an hour. I can talk about this for days and days. Laily knows that. Sports is medicine. There's some potential side effects, but let's focus on the benefits first. Improved overall physical, mental health and well-being. That is because of exercise, yes, but I think sports adds some things to it. There's the social element, right? Physical activity also has a lower risk of acquiring non-communicable diseases. And especially for children, it has cognitive benefits. And potentially also improved academic achievement, because if you pay better attention in class, because you're more fit, you're more focused, of course you can do better. Sports adds to that, the social benefit and the greater enjoyment. How fun is it to be active with friends? How fun is it to be active with people you can talk with, instead of just go by yourself for a little session? And also, I think that sports can be something of a marketing tool, because everybody likes to see sports, be part of sports. Children like to play, children like sports, adults like to see sports. So let's make them part of that. And that's a really powerful tool, I think, we have to increase physical activity levels and increase those benefits that we can get out of it. But we should not forget the side effects that we have to prevent and have to be careful about. I'm not saying these are no-goers, but something we have to take into account. And if we do all that, I do think we can bring exercise and sports as a medicine to our clinical rooms and reap all the benefits out of that, because there are many, many, many. Thank you so much.
Ooh, thank you very much, Evert. 30 minutes was not enough to listen to you. I was like watching a movie. It was very enjoyable and fun. Okay, so we continue with questions. I think there are already questions popped out, and maybe the organizer can share the questions which have, yeah. Okay, so from Anna as the sports medicine resident. Thank you for this insightful presentation. In your experience, how do you implement physical exercise and playground class that consists of children with different motor fitness levels? Should we differentiate the level based on the motor fitness? Should we start low, go slow to all the children, or how?
It's a good question. I don't like to separate them, because children want to play together. And I think, especially in children, one of the great benefits is they don't judge yet, and they can help each other out. And if we teach them low entry games that they can participate in, like rope skipping or playing a little bit of football with a certain set of easy rules to implement, they can all participate together. And then you will see that the ones who are least capable of doing it quickly improve and be able to participate and be part of the group. That's a big benefit here. So if you separate them again, you will never be part of the group, because then you're part of the low motor skill group and part of the high motor skill group. And then you keep that division. So you need to keep them together and make sure that, you know, you present them with activities that everybody can do to a certain level.
In what age was the research that you did in this case, Evert?
These were 8 to 12-year-olds. So that was primary school in the Netherlands.
I see. Okay, maybe shall we go to the next question, please? From Yosa Natasa, thank you for the amazing presentation, Professor. Do you have an example based on your experience of how to deal with people that still refuse to do physical activity despite knowing all these benefits? Thank you.
Yeah, I wish I had the answer to that. If someone doesn't want to do exercise, they just don't want to do exercise. The only thing we can do is make it as appealing and compelling as possible. I think a really good example now in the Netherlands here, it's popping up, is the padel. You know what that is? Is that like modern version of, it's not tennis, it's not squash, it's that combination where it's always 2 against 2. And it's a really low level entry type of sport. Everybody can do it. It looks like beach ball. But to really be good at it, and then you need to train. And if you go to a regular padel court, there's people of all sizes and shapes, people with overweight, people who are amazingly fit, and everybody can participate. And I think that's a good example of how we can use sports in this case and the social structure around it to get people involved, because it's yes, you're intensely active for an hour. You can be as active as you want. You can just stand still and still have a nice fun game with friends. And I think such sports will pop up more and more, where you're not just on your own, but out of a group social structure, you can easily participate. I hope it goes further. So that maybe that's going a little bit away from the question. From the research perspective, we actually do not know how to do this. But that's also because we look at it with a research mind, and I think we may need to look at it with a marketing mind. How do we get people in?
Okay. Do you need the racket for the paddle, I believe?
Yes.
Okay, it's more like a free way of doing tennis and badminton and other hand.
Yeah, it's difficult to describe. It's in a cage with a glass wall, and it's just great fun.
Okay. Okay, next question, please. I think we have another one. Yeah, from Gilang Nesta. About football as medicine for the cancer survivor, what kind of safety protocol or measurement was used before they can participate?
I think the question means about how were we sure that these people could participate safely in highly active. Yes. Of course, there's a physiological measurements before they are released to do any activity. So there's a good follow-up through sports and exercise physicians. These were the most active groups you saw. And there's a new phenomenon now popping up that is available for everybody. It's called walking football. And it's a football where you're not allowed to run, which sounds a little bit strange, but then it becomes more about skills and having fun. And that's a really good entry level into these types of exercises. So you can only walk, and you still need to, the games or the rules are still the same. You need to score on the other side's goal and all. But then everybody can participate because everybody's able to walk and they do get their physical activity in. But it needs to be endorsed and governed with a sports and exercise physician. And this might be something else we're trying to push for here in the Netherlands is we say exercise is medicine and sports is medicine, and we try to bring that to the clinic, but no one is responsible for that in the clinic. So we would like to have sports and exercise physicians as the linking pin and the specialists within the clinic who organizes these exercise programs as medicine or part of rehabilitation. So that's a medical professional who knows about how the body reacts to exercise and how different patients can react to exercise. And also is able to talk with the specialist like the oncologist or the cardiologist who rehabilitated them in the first place. But that's far ahead because that costs money, and for money, you need to make sure that the investment is worth it, and that requires a lot of research to show the insurance companies that this is a really good idea.
Yeah, I think we have another 2 questions to go. Can we go to the next question? Okay, from Tommy. Do you have experience of or data what happens from someone who dropped exercise? Are they back to exercise after that? Any bad condition like their weight increase or metabolic disease? What do you think to prevent dropout?
Many questions in one here. The first one, no. Yeah, of course, when you stop exercise, you lose the benefits. And after 1 or 2 weeks of no more exercise, you already have a detraining effect. Everybody has that, no matter which level of activity you've had before. So the easiest example is if I go to holidays in my summer holidays and for 2 weeks I'm not doing any exercise, I do notice that I have not been doing anything for 2 weeks. You gain a little bit of weight, you lose a little bit of fitness. That's normal. Then I go back to exercise because I have an internal motivation to be active. And yes, the first 1-2 weeks might be a little bit hard and not fun because I need to get back into shape. Perfect. We don't really know what happens to patients who were patients. They started to do exercise as part of their rehabilitation program to improve their fitness and improve their illness as well. What happens to these conditions when they drop out? That's really something we need to look in for the future, because that could be a reason for us to make sure they keep participating. I hope that if we use something as a medicine, exercise as a medicine, that once we've treated some of these conditions and people drop out of the exercise, they don't resort back to the same level. Better if they get out better, I hope they stay a little bit better. I'm unsure. How do we prevent dropout? I think it all depends on 2 things. Why do they participate? Do we force them to participate? Because many people just don't like to exercise. Let's be honest. It's nice to be lazy. I have some of these days too. I don't want to do anything today. And whatever I do, I don't like it, even though I know it's good for me. And a lot of people, if they're not used to exercise, they don't like it, they will do it twice because you tell them to, and then they will not show up anymore. So it's really important to find their internal motivation to do it. And if we say you need to go to the fitness and they say, I don't like fitness, I prefer running, let them run. Let them do whatever they want as long as it's an activity. So help them to find an activity that they like. Then they are unlikely to drop out because they don't like the activity. So that's already one thing. The other one to prevent them from drop out is don't have them have any negative experiences, or explain them that a negative experience might be part of it and what they can learn from it. So an injury is, it happens, right? You have a pain somewhere, fine, it's good. It's your body adapting. Right? You can turn that message around. And this is more into behavioral and cognitive science, which I don't know too much about, but again, a long answer to a lot of questions, and basically it says we don't know.
Okay, next question again. I think there are some more questions coming.
That's fine.
Okay, is this, I think this was the previous one, or I think the next one is from Iryulandi. I heard from your explanation that social factor is one of the most important for people to adhere to exercise. Group-based exercise is type of intervention that use social factor. Is there any research in sports medicine that directly measure how social factor or enjoyment in exercise correlate with increase in physical fitness or cardiorespiratory fitness?
The answer is simple. There's no science. It's all based on what we feel and what we think. And there's some concepts in behavioral sciences that revolve around this. Behavior is measured by, in essence, three constructs. It's your attitude, it's your social pressure or your social structure, and your what we call self-efficacy. So your self-efficacy is I'm big, I'm fat, I don't like exercise, so I can't do it. So that's a negative experience you have. So why do I even bother doing this? Because it will not work anyway. That's your self-efficacy. Your attitude is like, okay, good. I know it's good for me, exercise, I should do it. That's an attitude. Or like, not for me. That's also an attitude. So you want to make sure people have the self-efficacy, so they feel they can do it. And you want to have them to have a positive attitude. So they need to be positively. Now, social structure was the third one. And social structure is the most important one from the behavioral sciences perspective, because if people around you tell you that exercise is good, you start to believe it's good. Your attitude changes positively. And if people around you show you that it's possible, you start to believe that it's possible. So that social structure is a really important predictor in behavioral change. So that's yeah. And we know that from many things. So group pressure is an important one, and we can harness that. But there's no really studies being done in relation to this specific question. But it makes sense.
Okay, thank you. So we go to the next question from Nani, sports medicine. I think it's Dr. Nani. You mentioned entry level quite a lot in your talk. What is the recommendation around creating a friendly entry level to various sports?
Keep it fun. I think that's the best one. Yeah, it's all about increasing performance. Let's call it performance. And performance has many aspects to it. I think health as an outcome is also part of performance, because you want to go from your level A, where you are now, to a higher level. And for some people, that could be go from 5 kilometers running to 10 kilometers running. For some people, that can even be able to walk from the couch to the toilet by yourself. That's also an increase in performance. So that's what I mean with entry level. Where do you start? where are you now, and how do you achieve your goals? Now, how do you create a friendly entry level as a proposer of the exercise or sport, as a doctor, so to say? Make those expectations a little bit less. Because if someone comes in and says, okay, I've not been running my entire life and I want to run a marathon, as a doctor, you should say, well, why don't we start with 5 kilometers? And let's see how that goes. So you create a friendly entry level. People immediately find that it's possible to reach that that goal, and they start to like it more because they get positive experiences. So I think the positive experiences here is the key answer. So, and that's your skill and your role as a clinician, as a doctor with exercise as medicine. Make sure that people have that positive experience out of it and then stay doing it.
Okay, I think we have another two questions before. Then from Muhammad Aldo, it's regarding the study that you showed in the schools. Has the sports program been implemented throughout the Netherlands? Is there any difference between the sports program in regular schools and sports schools, such as football academy, in terms of the fitness?
Yes. Now, the first one, yes, it's been implementing throughout schools in the Netherlands. The system is so that schools can choose themselves what they would like to do and which programs they would like to run. So it's up to us to explain schools that this is a really good, easy program for them to do. But it's being implemented and it's getting more and more popular in schools. So that's answer one. Yes. We don't have regular schools and sports schools in the Netherlands. They're all regular open schools. So anyone can access any school they want, anywhere they want. And of course, there's differences because in a certain area, people choose certain schools than in other areas. But they're all basically regular schools with the same end goals after 6 years. So there's no, I don't know about any differences.
Mm-hmm. Okay, we go on to the next question. Do you think is there any relationship between physical activity and stunting? I think because this is one of our concerns here, stunting in children. Can it be
What is
one
stunting?
of the stunting is not growing well, so they.
Okay.
Can it be one of the prevention strategy to prevent stunting?
So more physical activity will prevent stunting. Could be, yes. I'm unsure. I need to look into the literature we know there. What we do know is that certainly there's a drop off on the other hand. So if you do too much, there's also growth limitations. So maybe it's in the start as well. I can look into that if you want.
Thank you. I think we still have like 2-3 minutes. Your what's this? The Karjijk, was it? The program of the
Krajicek,
playground.
yes.
Karjijk, yeah. Is it something new, and how is it different from the regular playground? It looks interesting to me with all the yeah. It's something that very specific to that.
It's not really new. It's been there, I think, for almost 20 years now.
Okay.
But what they do is they take a normal playground that's already been there for a while and they restructured it. So there's certain zones. There's a blue zone and a red zone and a green zone, and each zone has its own activity level. So kids can choose which one they want. So it's not that, the boys who want to play football take up the whole area and there's no room for other children to participate. So it's created in areas. And there's also another youth from the neighborhood are responsible for the playground. So there's 1 or 2 dedicated persons who are responsible for playground, and they organize activities there. They say, tonight we have a football tournament. Tonight we're going to play tennis. And then, they market that. So they draw children in. And it's not me going there or someone that the kids don't know going there. It's really a playground controlled by the local social community. And that's, I think, one of the big benefits. Room for everybody, driven by everybody who lives there.
Oh, it's more of a system on applying the playground which is already there instead of having a more specific equipments in the playground.
Yeah, well, there is equipment. So there are footballs and there's tennis rackets and there's volleyballs and they can put a net on, all these things. But in essence, it's just a normal playground that they completely remodel with colors and make it more appealing and put all the materials needed to play football there. And then you can get the materials there as well. And actually for free, you can be part of a sports club.
I see. So it means with a more vibrant environment of playground and also having involved everyone in managing that playground to be used optimally.
Again, the social structure there is important.
All right. Thank you very much, Evert. It is very such an insightful lecture to have you today. So maybe I would give Dr. Nani Cahyani to give her closure statement before we end the session today.
Well, thank you, Laily, and thank you, Prof. Evert Verhagen. I think most of us already knew many facts that you mentioned earlier, but then I really get how we can think more to incorporate what we already knew, like sport and exercise, to be more beneficial. And what strikes me is also that you remind us to warn the participant of the danger of exercise, not only the benefit, like we warn the side effect of any other medicine. But then sometimes if we talk about that too much, it will also scare people. So we have to have a very good dose on how to talk to the to our patient and the community. And also thank you so much for sharing so many experience in the Netherlands that hopefully we can adapt to our system. And yes, globally we have the same problem, some of same problems like the couch potato. So I think this 1 hour is enough. So we have to move since this is Saturday. We have to move more. Thank you so much, Professor Evert Verhagen. I really hope that in the future we can talk about many other things. And well, thank you for coming to this session. Back to Laily, we can have group photo before we end this session.
Okay, thank you, Dr. Nani. So can we have the pictures? Those who are not yet on their cameras, please on your camera. Please inform us before you take the picture so that I can give my brightest smile.
Countdown. I think people already have their camera on. Okay, 3, 2, 1. I think there's one more slide because there's so many participants today. Okay. 3, 2, 1. Okay.
Okay, thank you very much, Evert. Thank you very much.
Most welcome. Thank you.
Your participants.
Thank you.
Thank you very much.
Terima kasih. Please tell
Bye-bye.
us when you come
Thank
to
you,
Indonesia
Laily.
again, Prof.
I'll tell you.
We are waiting for you to come to Jakarta, not to Bali all the time.
Okay. Let's plan that, Laily. We will. Okay. Thank you.
Thank you,
Bye-bye.
Laily. Thank you,
Thank you.
Prof.
Bye-bye.
Bye-bye. Terima kasih semuanya. Terima kasih, Dokter Boy.
Sama-sama. Terima kasih hebat.
Semangat.